Greetings, I'm Dr. Han-Shik. Last lecture, I talked about inlay design. Today, I'm going to talk about the overall clinical process of CAD/CAM inlay. The contents for today. First, the work process of CAD/CAM inlay. I'm going to talk about the overall process. Second, advantage of CAD/CAM inlay. I'm going to talk about why we need CAD/CAM inlay. Third, tooth preparation process for CAD/CAM inlay. Fourth, indication and contraindication will be discussed. 5, bonding process, and then followed by conclusion and Q&A. First, the work process of CAD/CAM inlay. You prep within patient mouth and you take scan using oral scanner. Based on the data, using the dental system, inlay is designed. In order to mill it using milling machine, CAM software is used and output file is created. After that, 4-axis or 5-axis milling machine is used to mill the inlay. It is bonded to the oral cavity. When we do inlay, we can use 3 types of milling machine. First is 4-axis milling machine, which uses water. It uses 1 thick burr. Second, it is a 4-axis milling machine with water. It uses 3 different sizes of burr consequentially. Last but not least, it is 5-axis milling machine which does not use water and uses 3 different sizes of burr. Let's look at the first type of milling machine. Irrigation is done. Very thick burr mills the block material. As shown, material is put in the machine. It is fixated. You close the door. The machine is activated. Water comes out and 1 thick burr goes round and makes an inlay. The problem with 4-axis system which mills inlay with 1 thick burr is, as shown, there is quite a lot of gap between restoration and the tooth. The reason is because thick burr is used to fabricate inlay, and therefore details cannot be recreated. Either you need to do undermilling or overmilling. However, if you do undermilling, the inlay will not be able to be placed, and therefore, in order to set the inlay, overmilling is done in general, and therefore gap is formed. This is the same with this case. Between inlay and the prep tooth, there is a gap, and this gap used to be filled with resin cement. Next, this milling machine also uses water. It has 3 different sizes of burr to mill the CAD/CAM inlay. This is the same for this machine. A block material is placed. 3 different sizes of burr is used, and therefore very precise marginal fitness is shown. However, the problem with this system is, as shown, after you mill on the inlay, the connector is attached there as it is completed. However, if there's a connector on the contact point, it becomes very difficult to adjust the contact point. Unlike gold inlay, in the case of resin ceramic hybrid inlay, needs to be very passive. If you need to excessively adjust the contact, it will either be under contact adjustment or the contact will become loose. And there's quite a lot of possibility of this problem. In order to prevent sprue being attached on contact, the proximal contact area is milled. However, this form is also not quite satisfactory. This is no longer used. Third is a machine which does not use water, and circular disc is used to make inlay. This is a 5-axis machine. As shown, disc is placed and it is cut. Circular disc is used for milling. The benefit of 5-axis milling machine is preciseness. Unlike the first example, there's almost no gap between inlay and the tooth. As you can see in this case, after milling, no adjustment has been done. However, there's no gap between restoration and tooth. This is the benefit of 5-axis milling machine. However, in order to mill using 5-axis machine, you need to put the sprue on the occlusal surface, and then on top of it, connector is attached. The problem with it is that a very thick connector is connected to the occlusal surface, which reflects the anatomical traits. As a result, the anatomical aspect will be largely damaged, and in the bonding and occlusal adjustment phase, a lot of the material will be removed. In that case, when the patient is lying down, the patient will come to wonder why so much is being removed. The patient can come to have such questions. Recently, as shown, a new method has been introduced without sprue or connector, and this is called investment method. You cut half of inlay thickness first, and you invest it using plaster. Once the plaster sets, you turn it around and you cut the other side by half. Without using connector and sprue, very precisely, occlusal surface can be milled, and this is a true advantage. When 5-axis milling machine is used without using connector, you can see that the anatomical aspect is reflected on the occlusal surface. What kind of advantages are there in CAD/CAM inlay compared with gold inlay? More than anything else, patient discomfort goes down. Because within 1 hour, when the patient is under anesthesia, prep, milling, and bonding occurs, and therefore patient does not experience any hypersensitivity during that period, and patient discomfort goes down significantly, and patient treatment time goes down as well, and this is a major advantage. Second, in the past, after inlay was bonded, a lot of patients complained of hypersensitivity. However, in using hybrid resin ceramic, such complaints have gone down drastically. I thought long and hard, and the reason is because the patient is under anesthesia when bonding is made, there is less pain. Second, the process of temporary filling is out of the question. Therefore, cavity contamination is not a problem. Because of these reasons, hypersensitivity issue goes down. Third, it saves time and effort and cost for both patient and the dentist. Another advantage is that patients with orthodontic appliances, if you want to take impression the traditional way, you need to remove wire and block out the bracket using different materials, and only after that you can take impression. However, if you use scanner, you take scan, and on the next day, without removing all these appliances, bonding can be done, and restorative process can become very efficient. Third, I'm going to talk about tooth preparation for CAD/CAM inlay or onlay. When we provide analog inlays, the analog restoration goes through the hands of lab technician. If prep is insufficient, lab technician can block that out and can adjust it and make a perfect restoration. However, in the case of digital dentistry, it provides restoration based on the information that I provide. If prep is not good, then bad restorations will result. No one will correct my mistakes. Therefore, prep is very important. If you prep and scan half-mindedly, unsatisfactory restoration will be printed out. There's a high possibility that it will not fit. Digital dentistry, you cannot make the scanner customized to me. You need to customize yourself to the scanner. When you do inlay, if you use digital dentistry and provide good inlay, there are two reasons why low-level fit problem occurs. The first is quality of tooth preparation. This will inevitably lead to low-level fit. Second is because of hardware and software issues. As mentioned earlier, if you use a milling machine with thick burr, low-level fit restorations can result. In terms of CAM software, depending on which software you use, with connector or without connector, these factors can influence low-level fit. As shown, after you prep, the red bit is undercut. As in the analog method, if you do not relieve this undercut and just go ahead and print it out, the restoration will not have a good fit. Before doing final rendering, you need to adjust the prep to remove the undercut. If there's undercut, the fit of restoration will go down. Second, when you do CAD/CAM inlay, there are cases where you need to prep proximal boxes. If you use the round inlay burr and remove proximal area here, what kind of problems could occur? The path which the burr passed through, the yellow bit over here, this will not be milled. If so, the restoration fit will go down. Second, if you want to adjust the edge appropriately and do over reduction, what kind of problems could occur? You need to excessively prep adjacent teeth. And therefore, if you're going to make proximal box, you need to use ultrasonic tools additionally to do so. This is very important. This tool in the area for cutting, it has diamond coating. In the area which is in contact with adjacent teeth, it does not cut, and therefore adjacent teeth is safe. When you make proximal box, the separation of contact surface needs to be made thoroughly to get good scan. If you do the separation excessively, inlay can fracture due to occlusal force if it is not supported by tooth structure. In order to separate it, you can use disc type of ultrasonic device to remove it very appropriately. To summarize, when you form proximal box, the following ultrasonic helper kit needs to be used. I would like to emphasize this point. Fourth, I would like to talk about indication and contraindication for CAD/CAM inlay. This is my personal opinion. First, the best indication for CAD/CAM inlay is non-proximal case. BO, buccal occlusal, O cavity, lingual occlusal cavity. Very good prognosis is observed in non-proximal cases. Moving on to contraindication. In the molar area, posterior area, if excessive proximal case is included, it is not recommended. In this case, crown should be used to get better result. The reason is because prep is difficult, as well as bonding, removal of residual resin cement, and in the case if occlusal force is very strong, lower longevity of restoration can result. Another contraindication is if there is multiple surface decay. It is not recommended, and I believe using crown would lead to better results. In an onlay case, if the occlusal force is excessive, in the case of functional cusp, if possible, I would rather do crown than inlay. Fifth, I would like to talk about the bonding process. There are different cements used for bonding. At my dental clinic, I use resin cement, primer for tooth, and for restoration. On the left, you can see the prepped tooth before bonding, and on the right, everything has been complete after bonding. From left to right, I'm going to talk about what processes were involved, and I'm going to show you a video clip. As shown, milling was done on inlay. Fit is checked. If there is a sprue, it may be easy to check the fit. However, excessive occlusal adjustment is necessary. On the prepped tooth surface, you dry it, and after that, you use multi-link primer. The ratio is 1:1. You mix it thoroughly. You apply it on the inner surface of the tooth and wait for 1 minute to let it dry. After that, on the inner surface of the inlay, you use primer dedicated for resin ceramic. If possible, use one that is not sticky. After that, resin cement is mixed as shown. You mix thoroughly using a resin applicator. You put the cement within the oral cavity. You apply it evenly. Before it is set, with a short period of time, you fit it in. And after that, you press the middle and check whether it is perfectly set. You use Q-tip to remove the excess resin cement. You press once again, and as for light curing, you do it only for 1 second. And after that, to remove the excess cement that is on the adjacent teeth and proceed with final curing. Sprue and connector are removed. Finally, check the groove and do finishing on the margin. Use low speed burr, a dedicated burr, to do final occlusal adjustment and polishing. You etch the margin to prevent leakage, and after this is done, you use Viscover. It is a dedicated coating gel, and then all process included in the inlay bonding process is complete. Bonding is done. Conclusion. In the beginning, I talked about 3 types of milling machine for inlay fabrication. First is the milling machine with one size burr, and it has lack of marginal fitness, and this is rarely used these days. The second or third option is used in general, Third, if you have the 5-axis milling machine, you can use investment method and get satisfactory inlay. Let's look at cost efficiency on the left. This is a block that you can use only once, and on the right you use disc and fabricate dozens of inlay. On the right, you use 4-axis milling machine. On the left is 5-axis milling machine. If you look at cost efficiency block, cost is about 27,000 won, and it is 231,000 won per disc. However, because you can cut out tens of inlay, it is rather cost efficient by 4 or 5 times compared to the block type. Let's compare the 4-axis and 5-axis milling machine. 4-axis milling machine is very costly, and the quality is at times good and at times bad. You can get those kind of results. In the case of 5-axis milling machine, it is cheap and you can get consistent high quality restorations. As a result, the 5-axis milling machine is rather cost efficient. This is the end of clinical aspect of CAD/CAM inlay. Q&A session will be held. First, the question. How do you respond to hybrid resin ceramic inlay fracture? In most cases, fracture occurs in proximal case. What is in common is that it occurs when the occlusal force is very strong or if the patient likes a tougher food. If you experience fracture and if you provide the exact same restoration once again, then it could cause trusted issues, and therefore you should not provide inlay restoration. And I believe providing crown is a better option. Second question, what do you think about zirconia inlay? At times, people ask me whether I use a zirconia inlay. I'm going to compare hybrid resin ceramic inlay with a zirconia inlay. First, hybrid resin ceramic inlay, the total amount of time required from scan to setting is within 1 hour. On the other hand, zirconia inlay, it requires at least 2 to maximum 9 hours. The reason is because zirconia requires that much time for firing. What kind of problems could result? The biggest advantage of hybrid resin ceramic inlay is that everything is done within 1 hour when the patient is under anesthesia, and it does not cause any discomfort or hypersensitivity. However, in the case of zirconia, such advantages cannot be enjoyed. Therefore, there's the difference here. As mentioned, there's the difference of whether the patient is under anesthesia when bonding is done. And therefore, different problems can result. On the left, resin cement is used, and on the right, RMGI cement is used. And in terms of bonding, it's quite unfavorable. Zirconia inlay is unfavorable. Because resin cement is used, there's no difference in color amongst the tooth restoration and cement. However, in the case of zirconia inlay, there is color difference amongst the tooth restoration and cement. In the case of hybrid resin ceramic inlay, occlusal adjustment and poster treatment can be done easily. However, in the case of zirconia inlay, this is not easy at all. This is the end of my lecture. Next time, I'm going to use dental system to design single crown. Thank you for watching.